I'm sure that back in the day, Trevelyan was explaining why we can't release these British stores of food to Irish. And I'm sure he had run into an Irish kid who said that he'd prefer to starve if his parents couldn't give him a brown bag lunch of potatoes or whatever it was. It would be fascinating if someone actually sat Paul Ryan down and said and asked him of that. Jared Bernstein had a piece in the Times the other day, which argues, and again, this is a secondary argument, I think, beyond the moral argument. And the argument that, as members of society, we form a society to make sure that society functions to help everyone. But he makes the point that these programs that help people who are living in poverty, federal anti-poverty programs, is not just about providing for the ability for people to consume things like food and housing. But it also, there is plenty of data which show that it promotes future outcomes, better outcomes, that it's an investment. Recent study took advantage of the fact that SNAP gradually expanded across the country in the 1960s. And researchers could compare child outcomes conditional on food stamp receipts by checking the variance between counties that adopted or expanded the program at different times. In other words, you had basically a real-world experiment. Kids in County A got access to food stamps before kids in County B. Let's measure the outcomes, what happens to those kids who are similarly situated, at least economically, so much so that they both ultimately are eligible for food stamps. When poor pregnant women and their young children had access to food stamps, those children had better health and economic outcomes as adults than children born at the same time but in neighboring counties that did not yet offer nutritional support. As adults, children exposed to the program, starting in utero, experienced lower rates of metabolic syndrome, things like obesity, high blood pressure, heart disease, and diabetes. For women, they were more economically self-sufficient and they were more likely to graduate high school, find work, and avoid being in poverty. You have income supplements like the Earned Income Tax Credit or Child's Tax Credit have been found to have impacts that last well into adulthood for children of whose families receive them. And they were able to compare those outcomes with similarly situated children whose families did not get them or got less. And there's been plenty of research that show lasting outcomes in that respect as well. A study by the Center on Budget and Policy Priorities found that children in low-income families that received an additional $3,000 of annual income in 2005 dollars between the children's prenatal year and their 5th birthday earned an average of 17% more and worked 135 hours more annually as adults, compared with similar children whose families did not receive the added income. Income support leads to higher test scores in reading and math. Housing assistance is also found to have positive, lasting investment-type impacts, especially compared to those children who suffer homelessness as children. Low-income families with housing vouchers were 74% less likely to become homeless, 48% less likely to live in overcrowded housing, and moved fewer times over a 5-year period than similar low-income families that didn't receive housing assistance. These programs work. They work, in addition to being simply morally, I think, required.